As a nurse, it can truly feel like you're navigating a minefield of things that can go wrong. You're juggling a lot all at the same time, and just one thing out of place, and it all goes tumbling down. That being said, there are some things that will possibly end up getting your license taken away. Then, on the other hand, there are some things will almost definitely get it taken away. What are those mistakes? If they're so essential to avoid making, there must be a clear, distinct list of must not do behaviors to abide by. Luckily, there is. Today we're going to be looking at 5 mistakes you should never make if you want to avoid losing your nursing license. There are things that happen pretty frequently and often without realizing it. It's as severe as it is. A violation can creep up before you know it. And just one offense and you could be out of a job. For this reason, it's always best to veer on the side of caution when you're working in a nursing environment. Remember, if it feels against the rule, it probably is. So take notes, make sure you're subscribed to the channel, and let's dive into 5 mistakes that could cause you to lose your nursing license. Number 5, giving wrong medication. Giving someone the wrong medication happens, and mistakes often occur in high-stress situations, much like your day-to-day job. It can be as simple as misreading something or not double-checking, but it can cause massive problem down the line. Giving the patient the wrong medication can prolong their suffering. If it doesn't lead to more dire circumstances in the meantime. That is, one of the recommendations to reduce errors in medication and overall reduces harm is to use the 5 rights. When in doubt, these are the rights: patient, the right drugs, the right dose, the right route, and the right time. Ensure the right person get the proper medication, that they're given the right amount, that it is the best way for them to get it, and that is also the right time. Maybe it seems annoying, and it will feel like you've done this so many times and know what you're doing. But giving the wrong person the wrong dose or the wrong medicine can lead to further illness or even loss of life. It's better to do things the slow way and maybe overthink things a little if it means keeping someone out of harm's way. Number 4, neglecting patients. Sadly, this happens more often than anyone wants to admit. Patient neglect and abuse can occur when a nurse is intentionally causing pain or suffering, or because of a mistake made by a tired and overworked nurse with too many patients. Neglect and abuse hurt more than just the patient, as their friends and family suffer along with them too. This behavior is prevalent, especially in home health setting and nursing homes where patients have very little awareness of their surroundings. Neglect doesn't have to be active or purposeful. It can often be caused by factors outside of the nurse's control. Things like burnout, understaffing, or personal issue can all individually contribute to a distracting workplace or distracting nurses in general. Forgetfulness, however, can cause more damage than imagined and will often result in the loss of a license. Number 3, falsifying documentation or records. False documentation, in fact, accounts for nearly 3% of all disciplinary sanctions against nurses. Intentionally omitting information in your application is a typical example. Yes, as nurses may lead past convictions out of their application. If found out, this is a violation and may lead to a loss of license. This does broadly cover a lot of different instances, like providing false copy of the license. Some nurses may provide a fake license to cover up a suspension, but it can lead to a complete revocation when found out. It's important to know that you can only work within the scope of nursing that you are licensed for. With a license in good standing, if you are hired as a registered nurse, for example, you can't use your licensed practical nurse license in lieu. Often this can be an oversight, and your best bet is to err on the side of caution. Again, a good rule of thumb is if you're questioning it, it's better to go with the safe choice rather than a risky one. Number 2, unprofessional conduct. This is a broad term encompassing a lot of subjective behavior, judged on a case-by-case basis. This means that unprofessional conduct can range from using inappropriate language around colleagues or patient to have an affair with a superior. If you're concerned about the behavior in question, then it's better, again, to err on the side of caution, as unprofessional conduct can vary widely depending on your facility or supervisor. Falling asleep on the job, for instance, can lightly be argued if the nurse is suffering from burnout or low staffing. However, it may affect your chance of losing your license later if a patient is injured or harmed as a side effect of tiredness or inattentiveness. Unprofessional conduct can be a matter of opinion or a matter of your supervisor's handling of it. Your best bet, and I'm going to say it again, is to ensure that you conduct yourself professionally at work and ideally in your off time as well, as social media posts and online habits, when attached to your name, can follow you back to the practice as well. Number 1, diverting medication. It happens more often than it's talked about. People slip a few pills off to the side during their work. It's worth noting, though, doing this is actually a serious offense, punishable by revocation of your license and even jail time. If a loved one has finished all of their pain medication, leave it to their doctors to prescribe more or up their dose. It is not worth risking your career to boost someone else's addiction. In this case, losing your license may actually be the least of your concerns. Diverting drugs with the active intention to sell, or actually selling these drugs, can get you thrown into jail. Even if you're strapped for cash, it's not worth it, ladies and gentlemen. Often, unintentional mistakes and medical error rarely leads to revoking a nursing license. In fact, some of the most common reasons are related to intentional acts and are actively violating state or federal laws or the policy of the facility. Some of the biggest ones are drug abuse or mishandling, neglect, and engaging in unprofessional conduct. As stated throughout, your best bet is to veer on the side of caution. It's better to be overly cautious and retain your license than to make a life-altering mistake, sometimes without even realizing it. That's going to be all for today. Have you ever dealt with other people exhibiting these sorts of behaviors or making these mistakes in their daily practice? Do you have any idea on how to best avoid the burnout or anything that might lead to any one of these behaviors? We'd love to hear your story down below in the comment. If you like this video, make sure you leave a thumbs up down below. If you want to see more like this, subscribe to the channel, Patrice M. Foster, Nurse on the Run, with post notification turned on so you never miss a single upload. Have a wonderful day or time, night in your country.